Hello, my name's Simon Pearce and I'm a medical endocrinologist from the University of Newcastle and the Newcastle upon Tyne NHS hospitals in the UK. I'm going to talk today about the medical management of thyroid eye disease. So firstly, I'm just going to talk about the name. Very historically, thyroid eye disease was called exophthalmic goiter, then thyroid associated ophthalmopathy, and then in the 90s, the UGOGO organisation developed the term Graves' orbitopathy, which is probably the most correct scientific name. But patients find thyroid eye disease easy to understand, and doctors also find thyroid eye disease easy to understand. So for the rest of the talk, I'm going to call it thyroid eye disease, and I'm rather in favour of keeping it as simple as possible. So what I'm going to talk about today is who's affected by thyroid eye disease, how do doctors, that's both endocrinologists and ophthalmologists, think about thyroid eye disease, and then what treatments might be offered for people with different sorts of thyroid eye disease. Some treatments are suitable for everyone, some treatments are more suitable for people with severe or sight-threatening disease, others for people with mild disease. And I'm just going to give a broad brushstroke indication of what might be available. So first of all, who gets thyroid eye disease? Well, the majority of people who get thyroid eye disease have hyperthyroid Graves' disease. So 40% of people with that will go on to get thyroid eye disease. Of those who get thyroid eye disease, only a small proportion, 1 in 20 or about 5% or less even, will get optic neuropathy, which is often known as dysthyroid optic neuropathy, or DON for short. Then there are a small number of people, less than 5%, who start off with either hypothyroidism or so-called euthyroid Graves' disease. There's no abnormality of the thyroid function, but they develop thyroid eye disease irrespective. This is a small minority though. So these are rare cases. So there's a close temporal relationship to the onset of hypothyroidism, to the onset of thyroid eye disease. So really, if you look at this graph of the percentage of patients, in more than 100 patients, basically 60% get their thyroid eye disease within a year, either before 6 months before or 6 months after, surrounding their diagnosis of Graves' disease, and then most of the remainder get it more than 6 months after the first diagnosis. But there's quite a close clustering with the onset of the thyroid problem. So how do doctors think about thyroid eye disease? Well, UGOGO, that's the European Organisation for the Study of Graves' Orbitopathy, or TED, thyroid eye disease, has developed this classification. And so we would say mild thyroid eye disease has only a minor impact on quality of life, which is not sufficient to justify the risks of immunosuppressive treatment or surgical intervention to the eyes. Moderate or severe does impact quality of life to justify the risks of either immunosuppressive treatment or surgery, but it's short of sight-threatening disease. And then there's sight-threatening thyroid eye disease, which we know, as I mentioned, as dysthyroid optic neuropathy or DON, or corneal breakdown. And to save someone's sight, immediate intervention is required. And both of these the two other categories, mild or moderate to severe, the treatment is always fairly voluntary. If the patient doesn't want to have treatment, they don't have to. But there's very few patients would refuse a treatment if they think they're going to lose their vision or permanently lose function of one or both of their eyes. So the reason UGOGO take quality of life into account is this is a major consideration for most patients with thyroid eye disease. So we repeatedly hear people saying things like, well, my eyes are different to what they used to be. I have altered identity. I have a loss of confidence. I feel shame. My eyes feel disfigured. I wear sunglasses all the time because I don't like people looking in my eyes. It's embarrassing. Some people will stop going out and become socially withdrawn. They have difficulty doing simple everyday tasks that most people take for granted: driving, climbing steps, crossing the roads. Particularly people find going up to a pavement difficult, and then a lot of other symptoms: blurriness of the vision, watering of the eyes, pain or discomfort in the eyes. So these are all things that can really profoundly affect someone's quality of life and need to be taken into account when we're deciding treatment. So for mild active disease, The kind of symptoms that people will have is their eyes might be sore or gritty, they could be watery, there may be a change in appearance, particularly lid changes, the lids may be red or swollen, there can also be eyelid swelling or redness. The white of the eye, that's also known as the conjunctiva, can also start to appear pink or red, and that can also get some swelling behind it, so you get an appearance of a bit of jelly, and the eyeball may become more protuberant. There's more of the white of the eye visible, but probably not double vision. We would normally think double vision was a bit more severe than mild disease. So the recommendations for treatment of mild thyroid eye disease is firstly reassure the patient and explain the natural history, and I'll show you the natural history in the next slide or two. Smoking is an important risk factor, and we're going to try and get the patient's thyroid tests as good as possible, particularly avoiding hypothyroidism using ATD, which stands for antithyroid drugs. There are a few other treatments I'll go into as well. So first of all, natural history. The first thing that most people with mild thyroid eye disease need to know is that over time, this is severity or activity up here, and this is time on the horizontal axis, is over time, for most people, it improves spontaneously, even if we don't do anything. There's a period of inflammation, which doctors term activity, and this may be amenable to medical treatment with things like steroids or immunosuppression, but that's not really necessary for people with mild disease. But over time, things gradually improve, although they may not get back to 100% to the baseline, in other words, how your eyes looked in your wedding photos, for instance, which is what a lot of people think will be their normal. So this is important information because a lot of people find out they've got thyroid eye disease, look it up on the internet, and then go, "Oh my God, my eyes are going to, look terrible." And in fact, for 90% of people, they don't really progress very much, and it gets better of its own accord. So we use this clinical activity score to determine the amount of inflammation, that's the amount of activity in the eye, and that's two questions we call subjective symptoms for the patient to answer. Do you have spontaneous ache or pain behind the eye, or when you move your eyes left to right, up or down, does that give you gaze-evoked pain, or often described as tightness or stiffness for the patient? Then there are two signs of the eyelids, that's eyelid swelling or eyelid redness, and there are two signs for the white of the eye, the conjunctiva, there's eyelid swelling again, and eyelid redness, conjunctival swelling, conjunctival redness. And then lastly, in the corner of the eye adjacent to the nose, there's this little pip which you can see, and that can become inflamed as well. That's called the caruncle, and the membrane on next to the caruncle. So those can become inflamed, giving you a score out of 7. So there are 2 symptoms and then 5 signs that the doctor needs to have a look at in your eye to see how red or inflamed it is. And so that would determine the activity. And if the clinical activity is 3 or more, we generally think the eye is inflamed, and it could be improved by some anti-inflammatory treatments or immunomodulatory treatment. So smoking is also important. So people who smoke have about 4 times the risk of thyroid eye disease. They have a worse outcome with all the treatments. So we'd always proactively discuss smoking. Although e-cigarettes and vapes aren't a perfect thing, they're definitely less damaging to your eyes if you have thyroid eye disease than cigarettes. And also we'd offer nicotine replacement, so your endocrinologist should be able to offer you something appropriate, either patches or chewing gum or an inhaler for that to visit. Also, we avoid hypothyroidism, and particularly if you've had radioactive iodine, that in combination with hypothyroidism can often lead to active thyroid eye disease. I'll show you a slide about that. And also, if you're on antithyroid drugs, we don't want to let you go hypothyroid, because that can lead to fluid retention and worsen the thyroid eye disease as well. So this shows some historical data about what happened to people's eyes in the 2 years after they were treated for Graves' disease. So this is unchanged in green, worsened in the orange. So if you start on antithyroid drugs over the next 2 years, slightly less than 5% of people have worsening thyroid eye disease. With surgery, it's about the same. It's about 6% 8% who get worse. Whereas if you have radioactive iodine, actually it goes up to about 15% of people over 2 years that their thyroid eye disease will get worse. So if someone's already got thyroid eye disease, or we think they're at high risk of having thyroid eye disease, we'll avoid that radioiodine treatment. Also, selenium is a mineral that's found in nuts and cereals, most commonly in Brazil, or most strongly in Brazil nuts. So this was a randomized trial. So did the eyes improve, have no change, or worse? After 6 months of selenium therapy, patients' eyes were better, 65% were better, as compared to only about 40% who received placebo. So that's significant. And GoQol, that's the quality of life scale. The patients were asked if they felt better, and overwhelmingly they felt better with the selenium compared to the placebo treatment. So there's good scientific basis to give selenium, particularly in selenium countries where selenium nutrition is poor, which actually includes most of Europe. So next we're going to talk about moderate to severe thyroid eye disease. So anti-inflammatory treatments would be warranted if the patients have active inflamed eyes. So the first treatment will be methylprednisone, mycophenolate, and then there are some other antibody, so-called biologic treatments that could be offered. So the symptoms of patients with moderate or severe active disease would be the same as for mild disease, but eye discomfort is added in there, ache behind the eyes, double vision, which is particularly present very first thing in the morning when the patient wakes, severe change in appearance of the eyes, and it's sufficiently bad to affect the patient's quality of life. So people really want something doing about this at this stage. So this is the UGOGO algorithm. The first treatment is intravenous methylprednisone, and people will get 12 infusions, 1 a week for 12 weeks. If the eye disease is then inactive, in other words, those signs of inflammation have gone away, then there'll be a period of waiting and observation. And then if the patients still have eyelid problems or an abnormal appearance, then rehabilitative surgery could be offered perhaps 6 months or a year later. If there's no response, then more steroids can be given. Orbital radiotherapy is still shown to work in randomized trials. Mycophenolate, there is some evidence, although this is perhaps not as firmly demonstrated as other immunosuppressive treatments. And then biological treatments such as rituximab and teprotumumab and also tocilizumab have all shown randomized trials that they could be effective. So why do we prefer steroid infusions to oral steroid tablets? Well, UGOGO showed that the response rate to IV steroids, shown in the green, is better than for oral, and the side effects of IV are less than experienced for oral steroids. So IV steroids are more effective and have fewer side effects than taking the tablets every day by mouth using this once weekly protocol. Steroids, though, do have side effects. Your mood can go up and down. Very rarely, normally if someone's had pre-existing mental health issues, they can become psychotic, but this is very rare indeed, and we'd avoid giving high-dose steroids if the patient had that before. Patients do get increased appetite, and many patients gain a few kilos in weight during 12 weeks of steroid therapy. Shingles can become reactivated. There can be problems with the lining of the stomach, indigestion, a stomach ulcer, very, very rarely stomach bleeding, but we'd prevent this by giving omeprazole or another so-called PPI proton pump inhibitor drug. A few people get diabetes, but this tends to resolve when the steroids stop in almost every case, but not 100% of cases. So people do get diabetes occasionally, and then bone thinning, which can be prevented with a bisphosphonate treatment like alendronate, which we'd recommend while you're taking the treatment. So that's moderate to severe disease. Our main treatments are still in the UK steroids, and then sight-threatening disease, we'd go for the same steroids, apart from instead of receiving them once a week, you get them every day, and there's early surgery offered to let the pressure off the optic nerve out of the back of the eye if it's not responded. So people with sight-threatening disease, they stop being able to read the reading chart. So most people can read down to the bottom 2 or 3 lines, but if it's worse than that, then your eyesight's become significantly impaired. Also, lack of colour vision is an important sign that the optic nerve is under too much pressure, and if left without treatment, that can become permanent, so you can permanently lose the vision in the affected eye. So that's why we treat that aggressively, and if the steroids aren't working, we would go on to surgery within a week or 2 normally to improve that. So to summarise, the people who are affected by thyroid eye disease are mostly people with Graves' hypothyroidism. About 40% of them will get some degree of thyroid eye disease, and there are a few people who are unlucky to get it without having had Graves' hypothyroidism. Doctors think about thyroid eye disease in a few different ways: mild, moderate to severe, or sight-threatening, depending on really how the patient feels about it. And then active disease means active inflamed disease, and that can be taken away with steroids or other biologic anti-inflammatory treatments, or inactive, in which case surgical treatment could be offered. And Vicky Lee is going to talk about the surgical treatment in the next talk. And then what treatments might you be offered in the UK? Well, it depends on the severity, but there are several different medical options, including selenium, stop smoking, have some eye drops, and steroids, or even some of these biologic therapies, or surgery depending. So that's all I've got to say. Thank you very much for your attention.